You're called to the woods for a patient that was sawing wood, chainsaw slipped and cut his leg.
Patient in the woods, sawing, cut his leg.
Yep.
Scene safe.
Scene is safe.
I'm gonna put my gloves on, PSI. Let's go ahead and empty one. Since that PSI, number of patients.
1.
Does it look like he could have possibly fallen?
No.
Okay, we're gonna say no to C-spine for now. Since he cut himself, seems like badly, we're going to call for ALS, and then can I get like a general impression of what I see when I'm looking at him?
Mid-30s male, lying on ground supine with copious bleeding from his left inner thigh. And they're minimally responsive.
You said minimally responsive?
Yeah.
What happened?
Left inner thigh?
Yes.
Blood pressure pulse.
Okay.
So parents say,
So I say, I'm Tanner from
they were
the
playing
ambulance.
baseball, got
How does he
super
respond? Does he
harassed,
have full
cannot
complete
recover even though
sentences?
the game is over.
Does he struggle to respond?
And
He
what do you want your,
says
tell
like,
me what your initial assessment
"Hello,
is going,
my leg's cut." Like, he responds kinda. Like, he's kinda there.
Okay.
Breathing.
We're gonna say that he's alert.
Parents' medical history.
no meds.
The complaint is
No
the
history really.
bleeding on his copious bleeding on his left inner thigh here.
Nope.
That is what he called us for.
Are you allergic to anything?
Just cats.
Cats?
Mean cats.
Yeah.
Okay,
So
you notice their skin is
move on to
diaphoretic, intact,
March.
and-
So we're going to go ahead
and you
and
see.
apply direct pressure to the
You're
wound.
doing
Will that stop
I'm gonna
bleeding at all?
Tell me what your assessment. Tell me what you're assessing for.
Maybe a diabol.
Sorry.
It does not stop the blood.
It should be on.
Okay.
Oh, I
So
had-
in that case,
that was the
we're gonna
thing.
go ahead and rev.
Oh, okay, let's get rid of some
Was it?
Oh,
Oh no. We're gonna go ahead and rev gauze around it, and then we're
Oh,
going to go ahead and apply a tourniquet above the extremity, the upper part of the extremity. And we're going to call that part of March good. Going to go to airway. Is his airway patent?
Yep, it is intact.
Okay. Go to breathing. What is his rate of breathing?
26.
Okay.
Rate of breathing.
Okay, I'm gonna put this in your face, it's gonna help you breathe better, okay?
26 breaths per minute.
Yeah.
Go ahead and get lung sounds. Are they normal?
What are you looking for? EKG?
EKG.
They're
yeah.
clear.
Clear lung sound.
Invisible?
Just because of the 26, we're gonna go ahead and do 15 liters non-rebreathing.
The oxygen on the pulse ox takes a minute to show.
What was the rate and depth of his breathing?
Yeah,
I guess
so
before
you're
I come on the
breathing
thing, but
pretty hard about 40
I guess not rate, but depth. Say anything else. If not, it's good.
Actually, I'll help you.
It does not. It doesn't
okay.
say.
All good. I'll go down to circulation
You want 12?
and
Yeah.
just get his pulse really quick. It's right on.
Yeah.
His pulse is 78 over 50, and his heart rate is 122.
All right. You said pulse is
So
122.
how's she doing now?
And
Still working hard to breathe.
you gave me the BP. What was that?
We have 90.
Yeah, 78 over 50.
Okay, and then just the quality and color of his skin.
He's pale. I'm guessing pale, cool, clammy.
Velcro cleaning. All right, that makes sense. So we're gonna decide to go ahead and transport him, and I'll go ahead and get sample if I can before I move on to my secondary assessment. So, for what it's worth in this situation. So, and I'll get my partner will get vitals while I'm getting sample. So the sign symptoms, we know what's going on with his leg. We want to do OPQRST. And what brought this on, we kind of already know. Kind of a silly question to ask this guy. But does anything make it feel better or worse?
No.
Can he describe it to us?
No, he's kind of in and out of it.
Is it possible to get sample? Any of it?
He's not very responsive.
Okay.
so.
Very responsive. But does he respond at all to when I say things though?
If it's a loud noise.
Okay, so he's responsive to verbal
Yeah.
stimuli. Good. Change his AFU skill from alert to responsive to verbal stimuli, which I should have caught earlier. But so
We
we're
have that
did not do
after
sample then.
weird.
Can I get the full set of vitals then?
It's just not coming
Yep.
down
We're still working.
pretty hard. Okay, let's go ahead.
70
And-
over 50.
Okay.
Heart rate
Access,
122.
IV access.
IV access?
Yep.
Respiration
Okay.
26.
Okay.
And then
But no, we wouldn't have her
since you
IV
put him
access.
on O2, it's 92% on O2.
Okay, so we're gonna place you on our stretcher, put you in the back,
Did his respirations go down at all after giving him oxygen?
start an IV.
Oh, his.
IV.
Sorry, I didn't know if you wanted his second one. I thought you were
Okay.
just wanting.
You're gonna feel a little bit.
It's 24 now that you added the O2 onto there.
Okay, cool. And then I'll go ahead and move on to my secondary assessment.
Paul
So,
wants to know if she can write with it.
starting with
Hi.
D head, is there anything I'm gonna look for decapitatus, deformities, crevice, abrasions, bruisings, cuts, anything obvious that I can see looking at him?
What does
Is-
DCAT stand for?
Deformities, contusions, abrasions, crevice.
No.
That's why punctures, burns, stuff like that.
She's just getting
They're gonna ask you on the first one.
amputated,
Sure.
like that, they
But
can't breathe, and that the IV
Let's
didn't
look for all that.
18.
It's normal.
Anything weird with the ears? Anything
Nope, it's normal.
Alright,
people's
I'm
normal?
only calling you.
Normal and reactive to light.
Okay. And then is there JVD,
No.
trachea and line?
Trachea's in line.
And anything with the spine going on in the back?
Says
Step
he
off
can't
frame?
breathe.
Spine's good.
Okay, move on to the abdomen. We're going to, we already listened to the lung sounds earlier. We're going to palpate the abdomen. Does anything feel odd? Switching for decapitatus again.
Non-tender, no crepitus.
Okay. And checking lower abdomen.
Hospital, or are you gonna be?
We are, where are we?
Is
15 minutes.
Sorry, I
away
couldn't hear you.
from-
We're gonna feel his abdomen.
soft non-tender.
Soft, non-tender. Okay. Yeah, just
What's your-
checking. Is there anything I can see?
Okay, we're going
that-
children.
Oh, okay. Move on to the lower, his hips. Do they feel stable?
Stable. Yep.
Okay. Pelvis is stable. Is there anything leakage of fluids or anything like that in the pelvic area?
Pelvic. No.
Okay, and then we're gonna go ahead and first do the left leg.
I'm sorry,
Not gonna touch
Yeah.
the wound area. Move down, anything lower that's obvious, and then we're going to check for CMS in the left foot.
CMS is intact and no injuries other than the.
Yeah. And then go down to right leg, anything that I see or feel,
Nope. No injuries.
and then CMS on.
CMS intact.
Okay, and then move on to right arm. Is there anything I see, feel, any blood that ends up on my gloves or anything like that?
Nope. No injuries.
And then check CMS.
CMS intact.
Okay. And left
So
arm,
for the
any
breathing-
obvious things, anything I see, feel
No injuries.
in CMS.
I'd
Intact.
give her a,
And to the best of
maybe
my abilities, without
it's gonna
hurting
help
his wound too much,
slow your
lift
heart
him up a
down
little bit,
and probably help
see
you
is
breathe a
his
little better.
back
And
good,
we'll also
spine
give
good,
her,
stable, and all that.
Back is normal.
Okay. Good. So that'll
Do,
be the secondary assessment.
tablets
We're
this way.
going
No.
to,
with
hopefully we are transporting, since this guy is definitely necessary
Yep.
rapid
And
transport.
I'm sorry, you said 2
I think I said
the,
earlier.
yeah.
We're going to be doing that. I'm going to check every 5 minutes to see if his condition
Yeah,
changes, their
that's it.
response to
Repeat on the
the
vitals.
oxygen, I guess. And I will go ahead and give my
is
report.
looking,
This
little
is
sleepy.
a 30-year-old male with copious bleeding to the left inner thigh. He was caught with a saw blade in the woods. We put direct pressure on it, that didn't stop bleeding, put a tourniquet on him. He had respiration rate of 26 when I got there. Gave him 15 liters per minute of oxygen via mouth and breather. His respirations went down to 24 from 26. His pulse was 122, blood pressure 78 over 50, and his pulse ox was 92.
So,
He had no other things going on
Alright, well,
wrong with the rest of his body, so that was clear.
So,
That's done.
unconscious.
Is there anything else you'd like to do for your patient?
No.